Hello, how are you today? My name is Samsarah Morgan, and I'm the director and primary instructor for the Birth and Postpartum Caregiver Certification Program called the Professional Doula. I'm here to talk to you today about doulas. What is a doula? And the word comes to us from the Greek language. The root of it was in reference to the person, and in my research, this person is either a senior trusted female servant of the family or a long-term slave of the family in Greek culture. And that person's function was to assist the lady of the house when it was time for a baby to be born. It was a position of honor, and of course if you're having the baby of the patriarch, that's a very important deal in patriarchy, so you want to make sure that the most trusted person is there to bring forth the next generation. In modern times, modern doula tradition, doula has come to me in the person, generally female, although there are now more men coming into the profession. This person is the one to help the mama with the physical, emotional, and spiritual journey of having babies. So she's a person that provides hands-on support, massage, other various forms of body work if she's trained in those things. She's a person that is an information bank, helping the mom to firm up whatever she's received in her childbirth education class, or to provide childbirth education if the mom hasn't received any. She is the mom to actually make sure, she's a person to make sure that mom has real informed consent around all the hospital procedures, making sure that mom is completely clear. Sometimes even if doctors are forthcoming with information the mom doesn't understand and might feel uncomfortable to ask questions. So she has her doula to follow up with and to also help her do her own research about what she and her family's choices might be with regard to any interventions that they choose or don't want at all as part of their birth process. The doula's role is shifting again in a way that's very happy to me. It's a very wonderful addition to our profession, is that more and more doulas are getting to work in the home birth setting. So we're kind of going back to our original tradition, which is the person who helps in a home birth setting. Greek folks did not have big shiny corporate hospitals. Babies were being born at home, and doulas worked side by side with midwives. It's supporting the art and practice of midwifery care. And so doulas have always been part of home birth. I've had some people say to me, well, why would you want a doula at a home birth? I mean, doulas started out being people who provided support at home birth, so it's simply a return to what's always been known and part of human history. And it's wonderful to have that sisterhood kind of reunited, although doulas are always necessary. I think wherever women are giving birth, women need to have access to doula care, and absolutely they need access to traditionally trained midwives. And we pray that becomes the case, especially in this country, where so many women don't have that blessing, and our maternal mortality rates and our infant mortality rates are a reflection of that reality. They're not really good at all for a country of our resources, and the difference between us and the rest of the world is the access to holistic care, culturally competent care, woman-competent care that midwifery supplies with the support of loving and affirming doulas. So more and more doulas are being able to support birth wherever it's happening, either in home or hospital. It's very important for a doula to receive training to know the difference, the energetic difference in both of those environments, and how our how, what we do shifts slightly. But no matter what, our focus is on helping to create that environment for the mama, for her family, for the midwife, um, that the beautiful story of this baby's birth could play without interruption. Okay, so in hospital or at home, the doula is there to make sure that the mom has adequate food and drink, that she has a comfortable space to rest her head, whether it be in the hospital getting her additional pillows or blankets, whether it's at home helping with whatever the setup is there. Um, she can even make sure that the midwives are properly cared for, make sure they have food and drink. Sometimes midwives get so focused on, their energy is so on their client and so on the baby that, she might be a little peaked, so you want to make sure that's okay. We want to take a look at whatever family members the mom has invited to her birth environment, make sure they're weathering the process of birth well. Sometimes mamas want everybody there with them, but in our culture, since we have so little access to birth other than the horror stories on television and on movies, there could be people sitting in the room who are just absolutely scared to death. And that fear can be translated to the mama and impede her progress. Women in labor, pregnant women, are very, very open to emotional energy, and such things, even the most subtle shifts in energy, can perhaps instill fear in the mom and stop her process from moving as it ought to have moved. So doula is one who's trained in kind of sensing when that might be the case, who's had several visits with the family, with the woman and her family, who's developed a rapport, a friendship, a trust with them, so that she can approach and talk and help people soothe through and be able to just receive fully the gift that the laboring mama is giving them by inviting them into her birth. We also want to know that although the doula's one of her gracious services is to create this beautiful environment around the 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 laboring woman, but primarily her job is that laboring woman. Um, as the midwife is focused on the technical aspects of and the medical aspects of that baby's delivery, doulas are focused on that as well, the physical aspects as well, but the spiritual journey, the physicality of the labor itself, and the emotional needs of that mama. So we never leave her side except to go to the bathroom, have a glass of water maybe, in which case we make sure that someone is there to take our space. We are with her for the entire journey. The midwives may need to go and rest so that they are refreshed and ready to deliver this little one, intermittently checking on the mama. The doula is right there by the mama's side the whole time, unless the mama's asked for some space or private time with her partner. We're there, we're massaging, we're chanting, we're praying, we're singing, we're oming, we're whatever that mama needs to be present. You know, birth is the most powerful and amazing journey that a woman can take. There's so much richness, there's so much of her own spirit, of her own ancestral spirit that's going to be revealed to her in that process. And, we are the Sherpas. We are there to not take away from the mom's journey at all. There's a way that we are doing so much, but doing it in a way that's invisible, so that mama, so that her partner, so that the grandmas and grandpas, so that everybody in that room with that laboring woman can transform. And we assist in making the most sublime environment where that can happen, whether it's in the home or hospital or birth center. I have been blessed to train doulas in this form of spiritual service for approaching 17 years now. It's my gift to do so. If you would like to learn more about the profession of being a doula, if you would like to be trained to provide selfless service to mamas and babies, moms, dads, communities, please feel free to contact me. But the organization's name is Birth Professionals of the Bay Area. My name is Samsarah Morgan. Our phone number is 510-496-3491. You can find out information about the program by visiting the website www.niahealingcenter.org. I wish you a blessed and wonderful day. I look forward to your comments and questions. And be well and be happy.